You've already heard from me. I'm Wendy Cox. I'm from Care and Repair England. We do campaigning and policy and strategy work around housing in later life and housing services. So, yes, thank you.
Hello, I'm Warren Heppolette. I'm from the Greater Manchester Health and Social Care Partnership. So that's the partnership of all the councils, clinical commissioning groups, NHS organisations and other partners across Greater Manchester, looking at supporting people's health and wellbeing.
Hello, my name is Pam Smith. I am the Chief Executive of Stockport Council. I'm here today representing Greater Manchester Combined Authority. I'm the lead on ageing and age friendly, and I have the privilege of championing ageing, and also my pet kind of thing is to change the language of ageing and make it much more positive, because it is an asset that we're all getting older.
Hi, I'm James Baldwin, Policy Officer at Transport for Greater Manchester, and I lead on how Transport can support the ageing strategy. Well, I can try and answer from a transport perspective, but I don't think, I think this probably applies to all sectors and areas. So I think, as I spoke earlier, involving old people in transport planning is one of the findings that came out from the study that we did, and it's top of the action plan that I'm being putting together. And I don't know what the answer is, and I did tell my table that before they asked the question. So they insisted on asking it, putting me on the spot, so thank you, table 8. I think we do a lot of consultations at TFGM, but I realise that it's got a bit more about that. It's about an asset-based approach, using that local knowledge that not just older people, but what the local people can bring to the table about to try and help shape the public transport services that they have. Because one of the issues that we don't have, there's large parts of our transport network they don't have control over at the moment, and that's something we're looking to change. And we want, in a future where we do have more local control, then we absolutely want local people to be more involved, and older people. Yeah, I'm not sure what the answer is, but I think it's I don't think it's about just having small groups of transport enthusiasts as we might have done in the past. It's about how we can democratise transport. And if anyone's got any ideas, I'm all ears.
Okay. I had a kind of general perspective, really, because obviously I come from the kind of the health world rather than the transport world, but just wanted to reflect on actually some of the work that this network's done as well, because there's a different way of what we could do is make it really confusing, and for Transport for Greater Manchester, for our Health and Social Care Partnership, or the Combined Authority, or other public bodies in Greater Manchester to come out with different consultations at different points. Or we could do what we actually did in setting the Greater Manchester Age Friendly strategy, which was actually start from where you are and say what is it you'd like to see, and use that as a kind of challenge to the public services to rethink the way we organise our services. So I don't think it's all about us coming out to you. I think sometimes it's about networks like this organising your own challenge to public service, and then creating the conditions that mean that we have to kind of pay attention, and then all jointly buy into a single strategy around age friendly in Greater Manchester.
I think you're right that we get bogged down in language, and one of the things that we're doing, and I'll refer to Stockport as an example, is we're looking at, we're calling it all age friendly, because that takes away, if you look at all age, so whether you are, a woman at home or a man at home looking after a small child, you want to be connected to your community. If you're older and you're spending a lot of time in your neighbourhood, you want to be connected to your community. Housing, we're looking at an all-age approach to housing, because you might want to stay in that house as you get older, or you might not, and try and tailoring things. So instead of having the label of old age strategy, having all age strategy, and in Stockport that's what we're trying to do, and I'm feeding that back up into the GM architecture, because I think it's all too easy to stereotype, and I think we need to think about what do people need not what age are they. Now, you know, as you get older, let's be frank, you know, some things don't work as well, maybe, and you need to be cognizant of that. But I think that can happen at all different ages, and I think that's what we're trying to do. And colleagues will know that I've changed some pictures as well in some of the publications that we may have put out, because I think we need to present a positive image of ageing, and make sure that the environment works for us as we age. So I think that I'd kind of give that as a you know, as a positive example. The other kind of thing is, you know, I did a campaign not in Greater Manchester but called Coffee to Cocktails, you know, or the other way around, depending on what you know what you do, and it's kind of just it's just kind of not saying that, you know, you don't need maybe support in old age in different ways, but just making sure it's not stigmatised by the language that we use.
Okay.
Just to kind of reinforce that, really, because I think Pam's right that this sometimes this is about sometimes it's about language, and sometimes it's about a choice of either telling negative stories or telling positive stories. And both Pam and the Mayor are really quite forceful about calling us out on language, which is what I'd kind of encourage, I think. You know, where you think we're taking choices on reinforcing negative stories and negative images and pictures, then don't let us off the hook for that. The other thing that we can do as we're kind of implementing a strategy across Greater Manchester is to collect and then tell some of those kind of positive stories about great lives and about changed lives and about changed kind of, you know, support, assistance, connection, community, and all the rest of it. So I think we've got a choice about whether we tell positive stories or not. We've just got to take that choice, and it does feel like the atmosphere around the language is shifting a bit. People are checking themselves on, actually, am I reinforcing some of those negative stories? So I just think you've got to kind of keep your foot on the pedal with us on that, and you know, help, because we will shift a bit of the culture around this as long as we're all saying the same stuff. I've definitely not got an answer, but I don't know whether anybody in the room has been watching the it's the kind of the care home and 4-year-olds programme, because my kids absolutely, my children are 12 and 15, and they absolutely love it. Record it, rewatch it. It was in terms of the Christmas schedule, it was the main thing we looked out at. So I'm just thinking, I would love us to be harvesting some of the stories where we're doing that kind of intergenerational work in Greater Manchester, and finding out what our own kind of perspective on that is, and what it tells us where it works and how we can do more of it. Just because it felt like an enormously kind of positive and exciting thing. So I'm not sure that we've really explored what we're doing at the moment and what more we could do.
Okay, I've got a story. In my life in the past, I used to go into schools and do workshops on ageing. Don't know why they thought I could do it. Anyway, so this was in Wigan, so it's in Greater Manchester, and I had 4 different sessions during the day, different age groups, and without any encouragement and support and, you know, prompting, these kids had lots of respect and talked about their grandparents and their older neighbours with greater levels of respect than I expected from these young men. And I think there's some of it there. It's just that sometimes we don't see it out in the streets and around and about. But they surprised me, and it was actually their teachers that were a bit more sort of dismissive of older people than the younger people were. And I think sometimes those are the relationships where they're not so good anymore. And maybe it's the younger adults we need to be working on rather than the children. So it's something we can keep working on.
One of the, we work with a whole network of friends of groups, and friends of stations, friends of interchanges, and I think they're a really great community asset, and I think perhaps there's a potential there for sort of intergenerational work. I mean, we do have a problem with antisocial behaviour on public transport, something that we're trying to address. it does tend to be younger people who commit most of the problems. And I don't know whether there's something we can do there. I guess it's definitely something we can do, perhaps with linking those up to sort of youth service. I know that we go out and speak to schools a lot.
Okay.
There is and I think next Monday we're going to do a bit of an update on where we're up to at the steering group on that home improvement agency option, because that's exactly the kind of thing we're looking at. We've got a really mixed picture of that kind of handy-on service home improvement function. So we've done a pretty much kind of root branch review. Thought what are our range of options? We're getting to the stage where we need to start sharing some of the findings from that review and having the conversation on what is it we could do together to address the postcode lottery, which I suppose realise a bit of a levelling up in terms of the offers that's there. And tidy up some of the differential approaches that are taken for things like disabled facilities grants and so on, which is generally a bit that is a bit of a random lottery. So we'll come into the end of that review. I think that would be a really good thing for us to kind of connect on and position some of the choices that we're going to have to make, or some of the options and the opportunities that we've got. So I think we'll kick off that conversation next Monday at the steering group, and then see what we can bring back here.
I'd concur with that, because I think when you get the democratically elected members all on side saying this isn't acceptable, we're all going to join in, we're all going to do something about it, that's much more powerful. I've worked in a county district kind of setting, and where the county council maybe dictated what the districts would do, and it doesn't work. All it does is creates an us and them, whereas in Greater Manchester there's just an us. And I think that's the power of that. But I think what GM is really good at, and what the Health and Social Care Partnership has been really good at, is some standard setting. And I think it's about standard setting for people. So the things around at the other end of the spectrum, early years, this is what we expect early years to look like, or this is what we expect home improvement to look like. This is what citizens should expect from that. So I think it's really good that we can look at standards, but look at it not from what should a local authority do, but what do citizens expect and what do they need. And I think that's the power of Greater Manchester working very much together. And I'm glad Warren said that, because if I told my politicians that they had to do what GM said, they'd say no. We'll think about it and we'll work together on it. So.
I feel like I can say anything as a non-politician. I'd love to say the Greater Manchester Spatial Framework will have all houses future-proofed and built to a minimum lifetime home standard, but it wouldn't have any impact, except that I'd said it out loud, and you have heard it, so you can't deny that now. It's on record.
What you can do is use your planning policy as a lever. So I think as part of, and Stockport will be doing its revisiting its local plan. So on a local authority level, you can do it through your local plan. On a GM level, we can set the bar and say we set out what our expectations are. That is tricky in that private sector market, but I think we ought to do that. We ought to set out what our expectations are in terms of age friendly, and then it comes back to the thing I referred to earlier about having an all-age strategy. That includes your housing. What is your housing offer? How adaptable is it? But also really connecting with those communities and saying, well, in this community, so one of my communities, there's quite a number of older people, and they're in properties that are too big for them, but they want to stay in the communities, but there's no smaller housing in those communities. So by putting it in planning policy and favouring those other houses, you could perhaps push the developers in that direction. But the other thing is working with our housing associations and our registered social landlords. We can do work through them in terms of future-proofing housing and actually experimenting a bit more with them, because I think it was Kathy on our table from Southway who was talking about the different housing offers that they're now looking at. So I think there is an opportunity for Greater Manchester to work with its housing providers to do some of that experimentation and test some of that out, and maybe take some of the private developers then with us.
Yeah, I was going to say that I can't talk about adapting the inside of a house, but it's obviously it's really important where those adapted properties are situated and located, and that's why the work that we've been doing with the Greater Manchester Spatial Framework is so important, because we're looking at make sure that the development that takes place where it can easily be served by new or existing public transport, so that people don't necessarily have to rely on a car to get around. Because when if you rely on a car to get around, then you have to you're forced to give up driving, and then your adapted property can quickly become a prison for you. So I think transport is really important part of the housing mix.
I think there's a couple of opportunities there, because I think if you think historically, some of those kind of providers of domiciliary care in the home, have been quite disparate, quite disconnected, not really connected to us as a system. So we're starting to, in the first instance, just convene that group of care providers. Have a Greater Manchester focused conversation with them, start to uncover some of the agenda, whether it's whether it's actually about paying conditions, whether it's about standards and quality of care provision in the home, or whether it's about workforce development and training. We've now got the place where we can actually start having that conversation. So I think there might be a couple of opportunities here for us to start building a bit of an agenda for what do we think that kind of training, workforce education, workforce development agenda is for care home providers, because we've got the place to have the conversation and then look to shift some of that training. So there is quite an opportunity there, I think. Got to reckon there's a huge amount of work that's going on under a banner that we've offered as Living Well at Home, which is where some of that home care standards, quality, market sustainability questions are being faced, and it's Pam's Director of Adult Social Services that's leading that work with colleagues across Greater Manchester. And there are a number of things that are in there, but obviously front and centre is the fact that we've got very differential pay levels. I think there's a shared ambition to shift that in terms of what we think ought to be a rewarding and valued career that pays real living wages. But actually we've got to do that together, because otherwise what we'd end up doing is pushing people around Greater Manchester and weakening provision in one part. So it's really important that whilst the commissioners of those services are the individual local authorities, it is one of those areas that quickly breaks through and says, actually, if we're going to do this well, it's got to be something that we do together. So that's why we've kind of we picked the whole agenda off together. You're right. It's a really good and kind of key area to focus on. And I think what we're starting to build is firstly a kind of a recognition, and this is one of those kind of key areas of postcode lottery, quite fragile services, very different in very different places, very different on different days of the week, very different at different times of the day. So trying to get a bit of reliability in that is essential for the kind of the sustainability of the health and care system. So actually, if we're bad at this, it comes back as pressure on the hospital system, because it leads to readmissions, it leads to people not being supported well, not being able to maintain their independence. So actually, the brief for us is quite compelling. What we're starting to do now is organise through those integrated neighbourhood teams in each neighbourhood in Greater Manchester, those mix of professionals that can come together and provide the right range of more reliable care and support for a reliable and sustainable discharge package. often it's supported at the whole district level through some of those people that kind of set the frame of, or some of those teams that set the frame, what does a good discharge look like, what does good discharge planning look like, what does a competent package of support look like, and how can we ensure that it meets every person at every point of the day, every day of the week, and at every time of the day, so that we can guarantee that each discharge is reliable and safe and not likely to lead to another admission. So some of those kind of home first principles that people have talked about are starting now to be adopted in all parts of Greater Manchester. The proof of the pudding will be in whether we start to see lower levels of readmissions after 30, 60 and 90 days. And we've got a number of economies where that's starting to look like they're turning a corner because they've embedded those teams. They've got more reliable, better quality discharges and discharge support in the home. And the more we see those, the more we can start spreading the message across Greater Manchester for those that haven't yet introduced those kinds of teams and those kind of support arrangements, so that we can adopt it everywhere. And that's the kind of share and spread that I think is part of the way that we need to work to address the postcode lottery as well as the standards conversation.
Okay, I'm going to ask you a really unfair question first, which is kind of my job, which is there's been talk for a long time about transferring money from hospitals into the community. How successful are we in actually doing that?
Quite successful in a number of places, and this, because at one level this sometimes isn't about transferring money from the hospital to the community, it's about making them part of the same care organisation. So part of what we've seen in those places that I think have probably had longer to embed the models, in places like Rochdale and Tameside, Salford to a degree as well, is where the community team and whether it's social care staff or primary care staff or NHS community staff and the hospital team work as part of the same organisation, essentially with the same budget around the same population. And probably the most scaled example is the version in Rochdale, where they've seen a kind of a reallocation of resource that was funding the acute part of the service into the community part of the service. They've done it because they've made it the same organisation. Essentially, that's the Rochdale local care organisation, and it's moved annually. So year on year, there's about £2 million, which is now in community services as opposed to in the hospital because of the shift in the model. And it's not a transfer of money between two organisations, it's one organisation working very differently.
Okay. Sorry.
I know Warren's probably got a more detailed answer, but I think for councils, what we've seen this year is councils actually investing in creating more GP appointments. So particularly during winter, so we've seen Wigan invest in, Stockport have invested. So I think what we're trying to do is work together across health and local authorities to say having accessible more GP appointments anywhere is important. During winter, it's even more important because we can see the benefits. If more people in Stockport and in GM go to GP surgeries, they won't go to A&E. If they don't go to A&E, then they're unlikely to be admitted. One of the issues for us is the conversion rate between people turning up at A&E and being admitted. Because as soon as that happens, some of the costs are going to come the local authorities where they're going to come. So I think from a local authority, the GM, combined authority, we see the absolute importance of investing in more GP appointments because it means then that people aren't entering the system at a different point. And for me, I think it's much better for individuals to do that. Being in hospital is not the best thing. It's important for certain things, but it's more important to try and get the healthcare in your community where you need it. So I think we definitely see the investment in GP appointments as being critical to making sure that people are getting the right services in their community.
Can I just ask a specific question? So, everybody, there is a crisis in GP appointments in various places, but it's not equal across Greater Manchester. Some places you can get an appointment, and some places you can't. But part of the crisis is about employing GPs. And I just wondered if you could say something about what the plans are to try and make sure there are enough GPs, especially in the most disadvantaged areas of Manchester.
I think you're right, because a lot of this, there's a big part of the answer to the question will boil down to what's the capacity in primary care and in general practice, and we've got a fair way in terms of putting some extra resource in, as Pam's described. So from over the course of the last 2 years, we've put another 41 million into primary care, and that's been specifically around extending access and making more appointments available. Where it still leaves you with a problem is because this is recognised. We've had maybe 20 or 30 years, I think, where general practice has been under-recognised in terms of its contribution to the system, and we've put more and more resource into the acute hospital setting. So it still leaves you with that problem of I'm not sure we're at the end of that resource allocation to give us the capacity of primary care that we need. And then you get to your problem that even if we shifted the resource, we wouldn't actually have the workforce to be able to fill those roles. So there's quite a lot that needs to sit in that place. Firstly, we've got to kind of recognise you've got a here and now problem of retention, and the age profile of GPs is not helpful to us there, and we've got a genuine risk, in the same way as we have with a number of senior nursing roles as well, actually, of an age profile that is in the mid-50s and risks kind of falling off now. So we've got to think here and now about actually how do we make it attractive to kind of hold on to people longer? How do we make it attractive to kind of get people back into the system even if they've just retired? Because I still think we want them, and I still think we need them. And then we've got a bit about recognising the thing that's called the inverse care law, where actually it's quite an attractive thing to be a GP in Dorset or Surrey, and they never seem to have the problem of recruitment. So we've got to think right back to medical education, some of the value that's placed on general practice as a discipline. We never have any trouble recruiting doctors that are surgeons. We have much more trouble recruiting doctors who want careers in general practice or doctors who want careers in emergency medicine. So actually, we've got to rebalance the way that we apply reward into those jobs and make them more attractive, and be really clear in terms of our own control over medical education, that we've got to value the pulling through the number of GPs that we actually need. And that gives us almost a new devolution problem, really, because that's one bit of the system that we don't really have much of a handle on. That whole kind of medical education and training still feels a bit of a step away from us. And if we were going to answer our problems on where are our big gaps in terms of the health and care workforce, and how much control have we got over encouraging the level of training places that we need, I think we might need more control of that health education income resource.